For over 20 years, PHA has supported innovative research that drives new treatments, enhances clinical practices, and instills hope within the PH community. Beyond funding, PHA prioritizes professional education, advocacy, and patient support, contributing to comprehensive care for those impacted by PH. By investing in research and advocating for policy change, PHA brings us closer to a future without PH, with new breakthroughs that can change lives. In this episode of PH Insights, we'll dive into PHA's long-standing commitment to advancing research as part of its mission to extend and improve the lives affected by pulmonary hypertension. And leading today's conversation is Dr. Todd Bull, the incoming chair of PHA's Scientific Leadership Council. Let's get started.
Hi, welcome to PH Insights presented by the Pulmonary Hypertension Association. Join us as we delve into patient stories, healthcare updates, and the latest insights on pulmonary hypertension.
Hi, everyone. I'm Dr. Todd Bull, and I'm thrilled to be here for this special episode of Pulmonary Hypertension Insights. I'm a professor of medicine at the University of Colorado, and my area of both clinical work and research is in pulmonary vascular disease. In my role, I've seen firsthand the impact of PHA's commitment to research, funding a wide array of research initiatives that lead to advancement in the field. I, in fact, was early in my career a recipient of the Pulmonary Hypertension Association's Research Award. It really helped launch my career in pulmonary hypertension and pulmonary vascular disease, and have been thrilled to continue to work with a group of investigators helping others come up with these awards, and then looking to see what they're able to accomplish with their careers. Today, we're talking to a remarkable researcher, Dr. Rachel Hopper, who has been a recipient of a PHA research grant. Rachel, welcome, and thank you for joining the podcast today.
Thank you so much for having me, Todd.
So, Rachel, let's begin with introductions. Could you tell us a bit about your background, the area in which you work, and the awards that you've received?
Sure. So I am a pediatric cardiologist and PH specialist at Lucile Packard Children's Hospital at Stanford. I was fortunate to do my pediatric cardiology fellowship training here, working with Dr. Jeff Feinstein, seeing patients with PH, but also doing research in the laboratory of Dr. Marlene Rabinovich. And that was really where I learned so much about pulmonary hypertension and pulmonary vascular disease. I really fell in love with it during my training and knew that this was going to be the focus of my career. So after my training here, my first attending job was at the Children's Hospital of Philadelphia, or CHOP. And there I learned so much about pulmonary hypertension in infants, especially, given the big clinical populations that they have at CHOP. And I became especially interested in understanding pulmonary hypertension in different neonatal conditions. And I was fortunate to have Dr. Steve Kawit in the adult PH program at Penn serve as a research mentor to me as I sort of transitioned from the laboratory-based research I had done during my training to doing more clinical research. And the PHA Barst Fund grant really helped support my clinical research there, specifically focused on PH in children.
Perfect. So you definitely worked with some luminaries in the area of pulmonary hypertension, both at Stanford and then at Penn. Can you just, if we go back a little bit, can you kind of tell us in your training, where was the moment where you said, hey, this is of great interest to me, pulmonary vascular disease? Like what was it that really spoke to you?
Yeah, it really happened organically. I ended up assigned to work with Dr. Feinstein in clinic my first year of fellowship. And so I saw a lot of patients with pulmonary hypertension with him. And during my research in Dr. Rabinovich's lab, I remember looking at sections of explanted lungs from patients who had undergone transplant under the microscope and just being so fascinated by how much we're learning about this disease, but how much we still don't understand. And then going back and forth between the lab and the clinic, I really said, this is fascinating. And I really enjoy the relationships with patients, the challenge of working with kids of all ages, from premature babies all the way through, teenagers and young adults, and the challenge of the work that we still need to do to improve the care for our patients. So it really sort of, I had this moment one day in the lab. I was hearing some of the adult pulmonologists talk about doing extra training and doing an extra year in pulmonary hypertension. And no one had done that at Stanford yet on the pediatric side. And so I sort of had this light bulb moment and said, oh, this is something I could actually do. Our adult colleagues are doing this, but this is something that I could do too. And so I ended up being the first fellow at Stanford to spend an extra year in pulmonary hypertension. And thankfully, we've had a few other people do it since. But it was really that combination of seeing the patients and then studying the disease and trying to marry the two that really appealed to me.
Fantastic. Yes, I bet you if we trace this back to many of the investigators in pulmonary hypertension, cardiovascular world, it would be sort of a similar story that worked with, other both clinicians and researchers, and then like being able to me, that's, really the beauty of research is sort of seeing the patient and wondering what's happening there, and then trying to figure out, okay, how can I answer this question? And then having the appropriate mentors in place to really kind of both, help you ask the right questions, but then help you figure out how to answer them. So let's dive in a little bit deeper. So one of the key topics we want to explore is how receiving a PHA research grant impacted your career and the research that you do. Can you share a little bit about the Barst Pediatric Research Award and how that shaped your journey? And then again, talking about luminaries in PH, Robyn Barst was really a giant in this field, and hence, why this award in pediatrics was named after her. So.
Absolutely. It was such an honor to receive this award, and I was so grateful to the PHA for the support. And as you said, Dr. Barst was really a champion of the care of children with PH and of advancing the field. So it was really an honor to receive the award in her name. As you know, I'm sure from your own career and helping others, it's really challenging to start off a research career as an early faculty member, to try to, become an independent investigator. And as I had sort of mentioned, my research during fellowship had been more in the basic science realm. And so pursuing a career in clinical research was a bit of a change for me. And I was lucky to have great mentors, but it wasn't sort of a new avenue for me to pursue. And I am primarily a clinician, with the majority of my time spent seeing patients. So I wasn't eligible for a number of the grants that are primarily targeted to researchers. But I felt that it was really important to do clinical research, to be able to learn from our patients and to advance care. And the project that the grant supported was studying pulmonary hypertension in infants with congenital diaphragmatic hernia. And many of these babies have very severe pulmonary hypertension that can be life-threatening. And so understanding the risk factors and how better to care for these babies was really important to me, because that's what I was seeing in the hospital every day. And so the grant provided not only financial support to do the work, but also felt to me like a vote of confidence from the PHA that my work was important and that I was sort of on the right track in starting off my career.
Maybe for the listeners who may not be familiar with that specific medical problem, so the congenital diaphragmatic hernia, and then the thoughts about the development of PH, you could explain that. And then if you could tell us a little bit about what your specific research questions were as well. So.
Sure. So congenital diaphragmatic hernia is a birth defect that's actually fairly common, one in about 3,000 to 5,000 live births, where there's a hole in the diaphragm that allows the abdominal organs to migrate up into the chest. And as you might imagine, this has pretty profound impact on how the lung develops. The lung on that side of the defect is often very small, but we know that the other lung can also be sometimes impacted from this too. And so babies often have a lot of trouble breathing when they're first born, need mechanical ventilators to help them breathe, but also can have pretty significant pulmonary hypertension from this developmental abnormality in the lung. And that is often a major factor in early mortality risk, and is often a reason why babies need to end up staying in the ICU for a long period of time after birth. Most babies do get better over time with growth of the lung if they're able to survive that early period and undergo surgical repair of the hole in the diaphragm and get everything back to where it's supposed to be. But it is a condition that is really unique to children, and is something that we are just scratching the surface in terms of understanding why some babies have very severe pulmonary hypertension and some don't, and all of the different factors that go into it. So I was able to do a couple of studies during my time at CHOP, trying to understand risk factors for pulmonary hypertension, specifically looking at our use of a drug that we use to treat pulmonary arterial hypertension in these babies. And we started to look a bit at some of the potential genetic risk factors, and found that really the genetic risk factors are very different in babies with diaphragmatic hernia than sort of some of the traditional genes we think about in pulmonary arterial hypertension. So it's a condition that remains very challenging for us, but the more we study it and the more we try to understand it clinically through research like this, I think the better we're getting at taking care of these babies.
Great. And then in the specifics of your research award, then was this a model that you were making use of, or were you in the clinical space and trying to answer some questions?
It was more clinical research, looking at risk factors in our population. CHOP has a very large program for caring with children with different types of lung hypoplasia conditions, CDH being the most common. So we were able to capitalize on the database that we have of children at CHOP with this condition and really characterizing the clinical phenotype to try to understand the risk factors more significantly.
And then often in research, we're trying to answer, kind of specific questions. And that's, as investigators like yourself put grants together, they have, we've entitled them that, specific aims and things along those lines. But then also, so sometimes, in fact, frequently, we see impacts that might have more broad applications, areas that you can sort of take back and kind of translate that specific question, but say, okay, even questions I answer about this very specific disease state may have implications for patients with other forms of pulmonary hypertension. And is that something that you came across in your research at all? And a lot of times that spins into other questions down the road, that sort of thing.
Definitely. I think, being focused in pediatrics, we see a number of conditions that are related to developmental abnormalities. And there are a lot of parallels between what I saw in the children with congenital diaphragmatic hernia that may have overlap and some similarities to things like prematurity and the chronic lung disease of prematurity that we call bronchopulmonary dysplasia. We've also done some work looking at children with Down syndrome and pulmonary hypertension. And I think this was a focus at the most recent World Symposium in Pulmonary Hypertension, recognizing the impact of abnormal lung development on pulmonary hypertension in the neonatal period, but that can also persist throughout life and sometimes even into adulthood. So I think the lessons I learned from this specific project in CDH are really applicable to work I've done since, looking at other subpopulations of infants and children with developmentally related pulmonary hypertension.
And is this the award, research, or data that you've received from the PHA? Are these then now contributing to other grants that you're looking to submit down the road or have submitted already, sort of one leading to the next, if you will, at this point?
Definitely. I ended up leaving CHOP and coming back to Stanford and was able to, take the research lessons that I learned with me and certainly have been able to parlay this into other projects, both that I've done myself, but also working with collaborators. A number of the pediatric studies do require multi-center studies. And so that's something that the PHA has been supportive of, as well as other groups like the Pediatric Pulmonary Hypertension Network. And so I've been involved in some grants on behalf of the network and also myself. But I think learning how to write these grants and how to successfully convey your idea about a project has been really helpful as I've advanced in my career.
I have a similar experience. My award was really kind of the seed grant that helped me develop data, but also learn, anytime you submit a grant and get feedback from it, you learn how to ask your questions, more specifically, more concisely, and then how to answer them. And, then that, similar to you, my PHA research award then helped me get other awards down the road and really, again, helped, sort of focus my career and allowed me to stay in the PH space. Because, I think many listening, they're, to be able to have time dedicated to research, you do need funding for it. You need funding to support the questions, funding to support your time that you're using, and so these sort of seed awards that the PHA gave, I think, are there's just another nice example of really helping getting a career moving in the direction of to answer more questions down the road and take care of more patients with pulmonary hypertension. So PHA's dedication to research is critical, of course, to all of this. With annual research grant opportunities and a growing research endowment fund, PHA aims to ensure that important work like yours continues. Rachel, can you expand on your thoughts on the importance of PHA's ongoing support for research?
Sure. I think we would all agree that improving care of our patients through research is really inherent to the mission of the PHA and all of us who are part of the organization. It seems to me that it's really been a core value, recognizing the importance of research and the need to support it. And I think it should really continue to be, for all the reasons that we've sort of said here. It's so vital to support researchers of all types, those who are doing basic science research, those who are doing clinical research, because we really need more research to improve our therapies and ultimately to take better care of our patients.
I think, if we went all the way back to the beginning, to the impetus of the PHA, the famous kitchen table and the four sort of founders sitting around it, I think this was to be a fly on the wall, but really I think their focus was to bring people together, that is clinicians, investigators, to really make headway in this space for this disease, which, at that time there was very few therapies for, and really now looking at the wide array of treatments that are available into the adult space. And then Rachel, maybe as a pediatrician, can you kind of comment on then the challenges faced in the pediatric world with this, and how these medicines can be applied, but again, a lot of that, I think a lot of your focus is trying to get research focused in that pediatric space and develop therapies similar or more specific therapies in that direction, and the importance of that from a pediatric standpoint.
Absolutely. As probably will not come as a surprise to you, we have some unique challenges in studying children with pulmonary hypertension. We have fewer patient numbers than our adult colleagues. We have some challenges related to age and developmental stage of our children. Doing clinical drug studies, for example, I can't do a 6-minute walk test in a 1-year-old. We have to come up with some unique metrics, and we have to come up with really a collaborative approach much of the time to work together within the field to try to pool our numbers and pool our experience and really identify the questions that we need to ask together as a field and figure out the right way to approach it that makes sense for understanding uniquely pediatric disease. And I was so glad that the PHA sort of recognized this need for pediatric research with the Barst Fund grant, because there's not a lot of pediatric focused funding. I think that's really an area that would benefit from more support, because some of these conditions really are uniquely pediatric, and we do need to continue to study them and continue to support our researchers who are in these what feels like sometimes very niche fields studying rare conditions, but they're so important to improving the broader care of children with pulmonary hypertension.
Yeah, well said. And again, as we mentioned earlier, these specific areas, it is very frequently these lead to discoveries that then translate over into other aspects of the disease. And really, it's really how research moves forward. It's sort of the prepared mind of looking to see what comes out of these research questions and where they move from there. So what would you say, Richard, to someone who has provided support for these research awards? Why is it important to support research programs and these donation funds for the PHA to really kind of provide this availability for investigators at a variety of different stages in their careers?
Yeah, well, firstly, I would say thank you. This support is really vital to those of us who do this as a career. As you mentioned, many of us have to fund our research time. We're not able to do this without grant support. And so those who support these PHA funds have to know that their donations are really going to helping researchers, helping us to conduct the day-to-day research that eventually results in improved understanding of the disease and improved care of our patients. And we have a lot more work to do. I know you're very passionate about your work. I think most of us really, this is what gets us out of bed in the morning is, the research that we care so much about and are so dedicated to, but we really can't do without the funding support provided by these types of grants. And it helps us get a foot in the door as an early investigator, as it did for me, to kind of help get you started on the right track. But obviously that funding support is required across all types of research at all different levels and all stages of the career. So it's really important to continue to support research in all of these avenues.
Yeah, again, well said. I think this is again how we get young investigators in a career this pathway. This is how we make new discoveries that lead to then leverage bigger awards. this is, really it is research that's really improved our care of PH patients, so dramatically, really over the last, couple of decades even, and it's just accelerating from this point. But as anyone who's dealing with this disease or has a family member who's dealing with this disease knows that there's much more work to do. And thankfully there are many people, clinicians and investigators and clinical investigators who come across this space who are so interested in trying to continue to move it forward. And I think, just when I advise, young fellows, young faculty, to me, this is really where, where the career becomes when you have both a clinical interest and a desire to really help the patients, but then have the opportunity to do research that can really hopefully change and improve the way we improve people. That's where the real excitement can come out of this. And I can hear in your voice as well. This is, the excitement that comes in trying to really help people who are dealing with this difficult problem here. So Rachel, thank you. It's clear that the PHA support is having lasting impact, not only on your individual research, but on the field as a whole. For those listening, as we approach the end of the year, really consider supporting PHA's fundraising efforts. This is how we ensure that this critical research funding continues. This is how we move the needle. This is how we come up with better treatments. And again, really for your work, thank you for taking the time today to tell us about what it is that you do and how you got here and how the PHA helped you on this journey. Thank you for tuning in to PH Insights. To learn more about supporting PHA's mission and research initiatives, please visit phaassociation.org/research. Your contributions help advance research and bring us closer to a world without pulmonary hypertension. Until next time, stay informed, stay hopeful. Rachel, thank you again so much for your time and for the work that you do.
And thank you for listening to PH Insights presented by the Pulmonary Hypertension Association. Remember to subscribe and to join us every second and fourth Wednesday of the month for more valuable insights. Thank you for listening to this episode of PH Insights. We'd like to take a moment to thank our sponsors for their support of the PHA Connects program, which brings you the PH Insights podcast. Sponsors do not participate in the development of and do not endorse content of programming. For a list of our sponsors for 2024, please visit our website at phassociation.org/aboutph/sponsors. Thank you for listening.